So thank you very much for joining me today. I'm joined by one of our amazing clients at HLP Therapy. Just tell us your story. What brought you to the clinic?
Okay, so I think it was last sort of May, June time, I actually got diagnosed with mouth cancer. Had to go in for surgery sort of fairly quickly after that, within sort of probably 3 or 4 weeks. So fairly extensive surgery. It's about a 9 or 10 hour operation. Had to have part of my tongue removed, also the lymph nodes from my neck as well. I was off work for probably about a period of 3 months as well. So yeah, in a nutshell, that was how it all started, so to speak.
And how did you originally find what was wrong with your tongue? What alerted you to go to the GP first of all?
Yeah, so initially I actually thought I had an ulcer on my tongue. It's one of those where, I guess being a typical man, I left it for probably, well, not too long actually, probably only about a week. It still hadn't gone, so then I went to the pharmacy. They gave me some cream. Another week later, it still hadn't gone, so I actually booked an appointment at the doctor's. My local GP then had a quick look, didn't think it was anything too sinister, but they actually sent me off or referred me for biopsy just to make sure that it wasn't anything cancerous. I then obviously went down that path, and the guy I actually saw there in a private clinic over in Solihull, within literally 30 seconds of looking at it, said to me, "What do you think it could be?" And then the minute he said that, I kind of knew what was coming next.
No. And Andy, how has it been emotionally for you in terms of getting that diagnosis, going through the surgery and your recovery?
Look, it was a big shock, because when I went from the initial meeting with the doctor to go into that guy, I wasn't really concerned myself because they didn't seem to be concerned. So it was a massive shock. But I think one thing that really helped me, that things moved very, very quickly. So of course, while I was thinking about it and worried, the time from diagnosis to actually me going in to have surgery wasn't that long. It was probably, like I said, only about a 3 or 4 week period, which definitely helped me from a mental state. But I just tried to get into that state very, very quickly to be as positive as I could in obviously a negative situation, but that really, really helped me to be positive. And likewise, even from after having the surgery, my whole focus on what could I do to help myself to recover as quickly as possible and get back to normal. And, you know, I was willing to do whatever I needed to do to do that.
Absolutely. And do you have a good support network around you, family, friends? Have they helped you on this journey as well?
Yeah, massively. Obviously, my wife's been amazing. I think a lot of friends that, obviously there's certain friends you expect that are going to really step up in these sort of times, but it was amazing. Had a lot of other people that were unbelievable, went above and beyond, especially helping with the kids and stuff as well. So yeah, having that support network massively made a big difference, because it enabled me almost to focus on myself and recovering rather than worried about, you know, the kids and the family and stuff. So that made a big difference to me.
Yeah, it really does. So tell us then, after you had the surgery, it was a success, everything's all clear, yay, good to go, which is brilliant. Were you given any advice on the scar or how to look after the scar after your surgery?
No, it was actually very limited, to be honest with you, from the surgeon. So whilst the surgeon was brilliant in terms of what he did, obviously I guess once you've done that part, it's almost, well, I've done my part now, so on to the next. So it was actually very, very limited. I think he suggested some cream that I could almost rub in myself every now and again. And over time, I was told that whilst the scarring is going to remain, that will hopefully, you know, make some sort of difference. But the scarring, like I say, was pretty extensive at the start. It was very visible. It literally went all the way really from there, all the way around there, up above my neck. So it was very, very visible. I was very conscious of it. And at that point as well, is really when I decided to do something about it myself, which is kind of how I came into contact with Hannah.
Excellent. And tell us, because what the purpose of this video is to really get out about the partnership between therapist and client. So what have you been doing for yourself, Andy, to help with the scar?
Yeah, so I think one thing I'd say in terms of my whole experience with Hannah, obviously coming to have the hourly sessions, which I was doing pretty much every 2 weeks, was amazing and made a big, big difference. But one thing that Hannah really sort of implied to me very early is that, you know, the more that you can help yourself with this as well, the better the outcome is going to be. And because I was so focused on obviously getting the best outcome, I listened to Hannah all the way through and made sure I was doing what she was asking me to do outside of this. And that involved literally, I had some cream that I would either myself or my wife would help to apply every single day. Hannah was showing me the actual techniques as well to use myself, which again, so it wasn't a case of me just going off and doing my own thing. It really was that partnership. Hannah was brilliant, like I say, in terms of the advice, guidance, really, really clear on what I needed to do. And then from my side, it was that commitment from me to, every time I came back 2 weeks later, I could sit in front of Hannah and say, yes, I have been doing what you've asked me to do. I did it religiously every day. And more importantly, I could see the results myself of doing that as well. So it wasn't a case of me flying blind with this. I could see the benefits of doing it. And I think that made a big difference to the scar therapy, so to speak.
And how do you feel about the scar now, Andy?
I'm actually not very conscious of it now, to be honest with you. It's obviously still there to some degree, but the difference from where it was at the start, I mean, I go back to when I had my operation, I had all these staples in, my neck was, literally a big purple thing, swollen, and the surgeon kind of put it to me that I'm always going to have this scarring, so I had to try and get my head around it. But from where I was then to sort of working with Hannah, the difference that it's made has been, it's out of all proportion, below my expectations. So yeah, I couldn't be happy with it. Other people have even commented to me when I've spoken about it that they can barely even see it now. So it's almost, if I hadn't mentioned it, they wouldn't notice it. So yeah, it's been a fantastic experience and made a big difference to me.
Thank you so much. It has been a pleasure to watch you progress through all the treatment sessions, to see how the scar has changed, how you have changed as well. And I believe it's definitely a partnership, so all credit to you as well. So thank you very much.
No, thank you, Hannah. It's been amazing. Thank you.